So, excuse my hair. I'm pushing my time a little bit, but that's okay. So, this is my simulation reflection. Kind of how I reflected on it. It was different for me. I've never practiced on something that could basically give me feedback, and I guess it wasn't too much of that going on because it was similar to the CPR dummies that we're trained with in CPR. But just knowing like this was actually a scenario that's I could deal with one day, that I could deal with in my future, it kind of scared me a little bit, and it made me very nervous, very anxious. And even being in this situation, like when I was on the phone, though I may have sounded cool and nonchalant and like I knew what I was doing, I was very scared. I was very unsure of myself because I didn't know a lot of the answers. And that kind of scared me because I feel like in that situation, you have to know all the answers. You have to be able to give them what they need to be able to care for that patient to the best of their abilities. And if you don't have all the answers, I feel like you're not doing, your patient care to the best of your abilities. So that kind of threw me off because I've never had to deal with that. I've maybe called EMS one time in my life, and that was for, one of my athletes, and I knew most of the answers because she was my athlete, but I still didn't know a lot. I didn't know if she had insurance. I didn't know if she was allergic to anything because those aren't questions that, we tend to ask people. So, or at least in the situation that I was in as a coach, I don't, it's in your information, emergency forms that you fill out, but you don't encounter stuff like that. And at that age, it was a 16-year-old, so at that age, they should know what they're allergic to so they don't have to encounter it. So that's not so much my responsibility, and you never think you never want to be able to have to call EMS. But I had to, and just practicing that as a simulation terrified me. And then hearing the stories that Dr. V and Dr. E are talking about, that scared me even more because it's like these are situations that can happen to us as athletic trainers, and is this something that I want to have responsibility for? Like, I've never in my life wanted to have somebody else's life in my hands. That's why I didn't want to be a doctor. That's why I didn't want to be a vet. Like, I didn't want to have a profession where my actions decided the life of somebody else. And so you never really think that ATs have to deal with that. We don't have to, deal with bringing somebody back to life or finding the surgery that's going to save them. We're there for the sports. We're there for, rehab and prehab and all that. But then you're reminded that, hey, we take CPR for a reason. And especially with young athletes, sudden cardiac arrest is a serious thing. It's something that's real and something that is happening more frequently. And so you're put in situations where you will have to perform this, and somebody's life will be in your hands. And if you don't push hard enough, or you don't go deep enough, or, your breaths aren't on track, or, whatever, or you don't know information that you need to know, that could, be the deciding factor. So I had to really self-reflect and really, sit back and think about it. And it terrified me at first. But then once I really came down to it and I really sat down, this was an eye-opener for me for sure. Very scary. But it just made me want to keep being an AT more. Because just think about it, as scared and as nervous as I am, that athlete, that patient that I'm dealing with is even more scared and even more nervous than I am. And for me to put my feelings in front of theirs is poor on my part. That makes me a bad AT right away. Because they come first, their priority. And just knowing that, even with bad outcomes, you're always going to have good outcomes. And those good outcomes are going to be the ones that help you remember why you're doing what you're doing. The bad ones are going to suck. And it's inevitable. You're going to have bad outcomes, whether it's as serious as somebody's life or somebody not returning back to play as soon as they should. Your actions dictate the other person's actions. So I think that it was just an eye-opener for me. And yeah, it was scary, but at the same time, I've never been more excited to pursue my goal as an athletic trainer and to pursue my passion, because this is what I want to do. This is, you know, who I want to be. This is the life I want to live. And that comes with good and bad, and that comes with scary and not so scary, and that comes with, you know, everything else in between. So I like the simulation. I was very scared. Hospitals make me uncomfortable, so walking into a room that smells like a hospital was very, it was a lot right away. It was very shocking right away, especially when I just assumed that we were going to be coming in to a CPR dummy. And then actually going through the scenario and actually calling EMS and having to answer questions that I didn't know the answer to, and being put in that situation, it was really nerve-wracking. But through it all, I decided that this is the place I want to be, and this is what I want to keep going for, because that could be, you know, that question that somebody else doesn't know could be the question I know, and that's something that could save that person's life or could help them in the long run with their, you know, rehab or prehab or whatever. So that is something that I decided was the path I want to take and the path I want to stay on. And I also learned that teamwork is definitely better than doing it by yourself. I also found it very easy to fall into a role player instead of being a leader. And it's crazy because I was a collegiate athlete. You know, I was in the spotlight 24/7. You know, any action I did, it was on me, and I had to deal with that consequence. So for me to not want to take a lead role at this point, kind of scary, because I've never been scared of taking a lead role, but I've never been put in a position where I've had something so serious. Like, to me, basketball was serious and that was life, but that came like second nature to me. This is something that I have to work for and I have to get better at, and it was definitely something I was okay with taking a backseat to, and a role I was okay with taking as, you know, being told what to do instead of trying to dictate. But I do think that's something that I could work on and get better at. So dictating and the EMS call are key factors I could get better at, but just my overall like confidence with it, which just comes with practice and comes with being okay after the good and the bad. So that's my video reflection. I apologize for my hair and for my scenery as it is in my car. So other than that, thank you.